Hi, my name is Dr. Joanne Wang. I am a hand and upper extremity surgeon at Ventura Orthopedics, we're going to talk a little bit about shoulder arthritis. So the shoulder is a joint that has many sources of pain, a lot of structures packed into a tight region, so there are many reasons that a shoulder can hurt. But one reason is shoulder arthritis. And the treatments for this particular condition include anti-inflammatories, injections that we can perform in the office, and the final or end-stage treatment is something called a shoulder replacement surgery. There are two types of shoulder replacements that can be done generally, and I'm going to show you a little bit about them. So this is called an anatomic shoulder replacement. You'll notice that this ball, which is part of the shoulder joint, has been resurfaced, where the arthritic part of the ball has been cut out and replaced with a new metal ball component. And then on the socket side, you can't see it, but that has also been resurfaced. And there is a little piece of plastic right here that you can't see on the x-ray that interfaces with the metal ball. This type of shoulder replacement, the anatomic, is great for patients who have a working rotator cuff and who also have good and reasonable bone stock on the socket side of their shoulder joint. The other type of shoulder replacement that exists is something called a reverse total shoulder replacement. You'll notice on this image that the ball and the socket are reversed, and hence the name. So the ball actually goes on what was originally the socket side, which you'll see here, and the socket goes on what was originally the ball side. This is a great type of shoulder replacement. It's a very reliable one and appropriate for patients who don't have a good working rotator cuff. And it's also a great option for patients who, in their arthritis, have experienced a lot of bone loss or changes in the morphology of the socket side of their shoulder. If you're interested in talking about either of these options or interested in any kind of treatment for shoulder arthritis, please stop in and I'd be happy to take a look.